Good afternoon, ladies and gentlemen. It is indeed a Sunday, a Friday, a day that the Lord has made that we should all be glad and rejoice in it. Today is not all that bright, but once it's Sunday, we take it as a brighter day. This afternoon, I have with me my own brother, as usual, coming to the platform with me to discuss health issues. What is the topic for today? The topic for today is about pleural effusion. Preventive measures of pleural effusion. We've been hearing pleural effusion, but we don't know what exactly it is. This afternoon, at the end of the discussion, we will understand what a pleural effusion is, signs and symptoms of it, the causes, complications that it brings to individual, and how we can prevent ourselves from it. However, if we have it, what kind of investigations do we know to go through before the diagnostic process? And when we get a diagnosis, what do we do? This afternoon, once again, I have with me my own brother, Brother George Ackon. Brother George, you're welcome once again to Richmond Media. Brother George, you're welcome once again to Richmond
Yeah,
Media.
thank you.
You're welcome. How are you today?
By the grace of God, and as you said, the brightness of the day, we are brighten in the day, so we are fine. And I believe our viewers and our listeners, they are also doing well.
I believe so. Otherwise, we say you are all welcome, our viewers, friends, and family. Welcome to Richmond Media once again. And please, if you are here, today's topic is very, very important. So, therefore, we will encourage you to invite your friends and family to come and join us as we discuss this important issue. We often hear some people having, the standard belly that we don't know where that fluid is coming from. But this afternoon, you will hear where that fluid is not always being the diabo that people think of, but it is something else. So whoever is watching us this afternoon, please, I will encourage you to send the comments. Even if you don't want to write anything, just say hi so that we'll be able to acknowledge and recognize your presence with us. We already have one on board, which is our brother David Esiedu. Brother David, you're welcome once again. And Brother David says, carry on, Prof, which goes to Brother Ackon. Yeah, thank you so much. So we will therefore encourage you to invite everyone around you to join us this afternoon. Brother George, over to you. What is pleural effusion at all? Thank you.
Okay, thank you. If you can add my slides too. Yeah, so to our viewers and our listeners, this topic is one of the most reoccurring condition when you visit our health facilities, and we need to create an awareness. That's why, as Richmond Media Health Issues, whenever we identify and assess that a condition has become or is trying to trend, then we want to create awareness so that we all become aware and know how best we can live. So once again, we welcome each and everyone to Richmond Media Health Issues. So our viewers, our listeners, we welcome you in a special way. We want to talk about the preventive measures of pleural effusion. We have been hearing that someone was admitted to the hospital, then they will tell the person that, hey, they went to drain some fluid, they passed some tubes in the chest and drain some fluid. That's the condition we are coming to talk about. It's nothing a big issue. It's just simple conditions that we are handling. But first, we want to know how God has created. So this condition, if you are not careful, can let it complicate to the point that we will need to pass the tube, as we are seeing on the screen. Knowledge about this human system is our responsibility. God created this human system as a living machinery, but it's you and I, our duty to know how to maintain it, because the perfect will of God is for us to get good health. Now, when we talk about pleural, when you look on our screen now, you realize that when you take the respiratory tract or the respiratory system, that's talk about the lungs purposely. So you realize that where we will say the house of our breathing, the lungs. So within the lungs, God knew that it will expand and relax when we are breathing. Therefore, he created some space within this respiratory tract, and that's what we call the pleura. The pleura is the space that is located. So this condition we are talking about is not a leg issue, but it's a condition that pertains to our lungs, the respiratory system or the respiratory tract. So our viewers and our listeners should follow us in that angle. So if nothing at all, just picture your chest area. That is where we are talking about. So as the lungs is like two joined organ, we have the bluish part we are seeing, the space there, that is what we call the pleura. And with this pleura, it has a vital role to play. God didn't create a space there just for nothing, but it's about to do some magic or some role. Its role is that it will cushion the lungs. So as you are seeing, it's surrounding the lungs. So it will cushion the lungs and reduce any friction that may develop between the lungs. So without it, it means when the lungs want to expand and close, there will be some friction, which will cause additional pain. But God created this space just to prevent that friction between the lungs, the rib cage, and also the chest cavity. That's why when we are breathing, we are not feeling any pains because of this pleural space. Another aspect is that within this pleural space, God also, in his own wisdom, put some lubricant within it. That is what we call the pleural fluid. So you see, wherever there is joint within our body, God has initiated a fluid. So when you take your upper part, from your arm, wherever there is joint, the reason why you are not hearing any sound, crack, 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 is that there is a slippery fluid that will prevent friction and also the noisy part. Same way internally, within this pleural space, if there is nothing like a jelly or a lubricant, when the lungs are working, there will be friction, and that will also cause another pain. So God has put some lubricant within, and that is not what we call as pleural effusion, if we are following. And with the same pleura or the pleura that we are talking about, it has two things. We have the visceral pleura. The visceral means that the thin, slippery membrane that covers the surface of the lungs that we are seeing. And this one, it will dip into the areas that separate the lobes. The lobes are like the orange. When you take orange and you open orange, you see the lobes within, the fibrous nature. That is what we call the lobes. So we have the visceral pleura. Then we have what we call the parietal. The parietal pleura is the membrane that covers the outer part of the lungs or the chest wall. But we will say that pleural effusion. So we understanding the pleura as the space that covers the lungs, and within it we have a lubricant called the pleural fluid. Effusion here means that any abnormal collection of fluid in a hollow space or in between tissues of the body. So effusion is abnormal collection of fluid within a space or tissues within the body. So in linking to this pleural space, it means that when there is accumulation of excess fluid in the pleural space, then we have what we call as pleural effusion. So when you look at this slice, you realize that the space, the lubricant is within, that's the bluish. But when you come to this slide, you realize that there is accumulation of excess fluid, more than the gel or the lubricant, the pleural fluid, in the pleural space. And when that occurs, then an individual will begin to exhibit signs and symptoms like the difficulty in breathing and what we will be talking about. So pleural effusion itself It's not the main condition, but whenever there is fluid building up within the pleural space, it tells you that there is a symptoms of an underlying cause, meaning that some condition is giving you the symptoms, and one of it is what we call the pleural effusion, fluid accumulation in the pleural space. And this condition is now becoming the trending condition. Thank you.
Thank you so much, Brother George. We have Brother Sapon, Prince Sapon says, Piaga Piaga is watching. So, Piaga, you're welcome on board all the time. Please don't forget to join us the same time and invite friends and family to join us as they also partake in whatever we are discussing here, which is very, very important. Anything concerning the lungs concerns our breathing. Therefore, breathing is very, very important. Um, if now that we know the overview of the pleural effusion, what type of fluid can accumulate the pleural space, please?
Okay, so you realize that the normal fluid is like a lubricant, and its work is to help lubricate the space to prevent friction. So whenever there is accumulation of fluid in the space, we have types of fluid that can accumulate in the space. Number one, we have what we call like the fluid. This particular type of fluid it looks like a milky fluid accumulating in the space, and that is one aspect. So the fluid that is accumulating on anti-Bimah space will be different from what might accumulate in my pleural space depending on the cause. So that's the first one. Another aspect too is pus. We have some people, the accumulation of that fluid is full of pus, and that is also another type of fluid. So aside the milky, we have the pus also can accumulate in that space. Pus is like someone who is having wound and you want to press, then that sticky fluid that comes out, that's what we term as pus. Then also we have what we call the serous fluid building up in the pleural space, and we can call it as hydrothorax. So at times some individuals, it will be like a serous fluid. It looks like the lubricant, but in this case it goes beyond the quantity of the lubricant, and that's what we call the hydrothorax. Then also some individuals own might not be a clear fluid or a pus or a milky fluid that you can talk about. It will be bloody, and that's what we call as hemothorax. It means blood accumulation in the pleural space. So when you do your investigation, you realize that no, the fluid that the prescriber is withdrawing, it's solely bloody, then we can term it as a hemothorax. That is blood accumulation in the pleural space. So aside these fluids, at times too, some individuals, there will be it will not be fluid, but it will be air, and that's what we call the pneumothorax. That's accumulation of excess air in the pleural space, and these are some of the types of the fluids that can accumulate in the space that we want to also create awareness. Thank you. Thank you. You are on mute.
I'm very sorry.
Okay.
Thank you so much, brother. Now that we know the type of fluid that accumulates the pleural space, we'll be able to identify when it comes. We're not just hoping that it comes to you, but you never know. Yeah, we're not wishing that for you, but in case you see it around you, someone also, you'll be able to say, oh, yes, this is what we were discussing on Richmond Media the other day. So I think I can identify this type of fluid. Sister Josephine Adebi, that is Mrs. Ackon, says, thank you for educating us. Thank you, sister, for joining us. Sister Tai Ido says, beautiful afternoon to you both on beautiful topic. Thank you so much, Sister Tai, for your support at all times. We really appreciate everyone that is watching us this afternoon contributing to the success of this program. Brother George, now that we know the types of fluid, can we know the causes of pleural effusion at all? Thank you.
Okay, thank you. In this life, I always say that nothing occurs without a cause. For every condition we might be going through, there is something that is causing that condition to happen. And let all also get the understanding that with this pleural effusion, it tells you that there is an underlying cause, and it's the fluid building up telling you that it's a symptom of the underlying cause. So even you taking the fluid off does not solve the problem, but rather you need to know the cause, and that is most important as well. Number one is what we call the congestive heart failure. Congestive heart failure. With congestive heart failure, we are saying that when the heart fails to perform its adequate role, the heart needs to pump to take fluid through, or the blood through the lungs, then to other parts of the body, but it needs to first work within the chambers of itself first. But one thing is that individuals who have heart condition and they did not take critical look at it, then it worsened. Then one of its complications is heart failure. It means that there will be excess fluid buildup in the heart muscles or in the heart. Therefore, the heart needs to push things to the lungs. And when the lungs also finish its work, the heart needs to pump to push it again from the lungs back to the heart again before it goes. So when you have heart failure, it means the heart is not able to perform its adequate role. So there will be fluid built up in this chest area we are talking about, and can lead to, or it can give you the symptoms or the sign of this pleural effusion that we are talking about. And it's congestive heart failure is the most common cause of pleural effusion among the others. So you see the man standing there, you realize that he's having pleural effusion. So congestive heart failure leading to that, there was accumulation of fluid in the heart, then making a part of the lungs, some fluid leaking into the space. And when it happens like that, it will become flooded. Then that will lead to the symptoms we will be talking about. So if we are having heart issue, let's treat it well before it complicates into heart failure and you get another symptoms like pleural effusion. That's one cause. Another cause is what we call the autoimmune diseases. Autoimmune diseases is when the healthy cells within our body, due to what we inhale, due to what we eat, turn up affecting the immune system or the immune cells. Then they turn up fights within themselves, and that's what we call the autoimmune diseases. So the soldiers, that's the layman's view, within the body, turning up to fight themselves can bring a disorder within the system, and one is the sign or the symptoms is pleural effusion. One cause of the autoimmune diseases is rheumatoid arthritis. Rheumatoid arthritis. Rheumatoid arthritis is a chronic disease that causes inflammation. It will cause inflammation around the body. Commonly, it presents with joint pains. Commonly, that's how it presents. But it can also lead to heart and lungs and the nervous system. So it doesn't always affect purposely the joint as they mostly complain, but it goes beyond that to affect the heart, the lungs, the cartilages because of that chronic inflammation. And when that occurs, then one of its signs that it can give you, because most of them end up having difficulty in breathing, affecting the lungs, leaving the scarring. Then when the lungs is being affected and is not able to also perform its role well, then fluid begins to be leaking into the pleural space, thereby allowing you or the individual to experience what we call the pleural effusion. Another aspect of the autoimmune disease is what we call the lupus diseases. Per the picture you are seeing, the lupus diseases is also autoimmune diseases that affect joints, the kidney, the blood cells, the brain, the heart, and the lungs. So if you are having, based on our lifestyle, most of the autoimmune diseases are also linked to our lifestyle. That's the common thing. So if our lifestyle, it's also giving a photocopy of the immune system or immune cells within, and they turn up trigger, fighting each other, bullying each other, then take note that one of the signs that you get is what we call autoimmune disease, because this lupus disease also affects the lungs, the kidney, the blood cells, the muscles, the joints. And when they also dysfunction, you are likely to suffer this condition. So aside the heart failure, autoimmune disease is the next one. Then another cause is infection of the lungs. When you have infection of the lungs, simply means there are some cells or microorganisms. That's when you see it in the mouth, it's the house. But when it gets into the lungs, it becomes a foreigner. Then when the cells within the lungs try to fight it and bring it out, that process it goes through is what we call the inflammatory response. And it can lead to the pneumonia, being inflammation or infection of the lungs. That's the pneumonia. So whenever we hear pneumonia, it's a condition of the lungs due to infection and the inflammatory response allowing the lungs to inflame. That's what we call pneumonia. Then also we have a bacteria that we call the Mycobacterium tuberculosis. Those cells or those bacteria also attack the lungs. And when it attacks the lungs, we have a condition which emanates from it, and we will term it as tuberculosis. So infection of the lungs, like the pneumonia, like the tuberculosis, can also predispose an individual to also get pleural effusion if not well tackled. So infection is also another form of the or another cause of this condition. Another one is a trauma that affects the chest or the lungs. So either by fighting and someone choop you with a knife, or you get an accident and your lung area or your chest area hits a place and there's a trauma or there's a wound that has occurred, that aspect will affect the quality function of the lungs. And when the function is being impaired, there can be a problem where fluid can leak or blood can leak into the space, and it mostly occurs in those people when they have the pleural effusion. Most of the fluid, as we've talked about, the milky, the pus, the blood, and the serous fluid, they are mostly to see blood accumulation in the pleural space. So a trauma is also part. So we advise our young men, our youth, to play a game that will not lead to this aspect. Let's live a healthy game so that we will not be choking ourselves. And also the drivers and other things, we need to be mindful so that road traffic accident can minimize from us not to get this condition. Another aspect is lung cancer, tumor. When there is a tumor or cancer means abnormal or overgrowth of cells at a particular place. And when that occurs, where it's being located, then we give it name. So our dear loved ones who have cancer pertaining to the lungs, if you are also not careful and treated, it can also give you a sign which is pleural effusion. Then we need to also note that. Then another aspect is what we call the pulmonary embolism. Pulmonary embolism, the name is big, but the explanation is small. It means that there is a clot blocking the vessels that supply blood to the lungs. And when that clot, as the blood is moving through the blood vessels, like you putting a leaf in a river, then it's going, then it will chuck a stone, then it will turn. That movement, when this clot block a blood vessel supplying the lungs, then it will impair blood circulation to the other part of the lungs. And this clot is what we are terming as pulmonary embolism. And this blockage of the arteries can also affect the normal functioning of the lungs. And when it's being affected, it can also lead to infarction, which means cell death of that particular area of the lung that is not receiving blood, because the blood will contain nutrients and oxygen. And when that part is dying off, you are also likely to see that no life there. So fluid will rather be seeping in, or there will be accumulation of fluid at that space because of inactivity or dysfunction of that particular part. Either the left side of the lungs or the right side of the lungs, or both, can also lead to that. Then at times too, it can come from a liver or a kidney diseases. So some individuals, as we have said, they will be having a liver condition or a kidney condition. Then its complication can also lead to pleural effusion. So as we said, you need to note the cause, but not that the fluid is our problem. No, but just that when the fluid or the air accumulates in that space, the individual will go through discomfort. But you taking the fluid or the air out is not the main treatment. It's just relieving the pain. Then you treat the cause, either a liver, kidney, or a tumor or heart failure. Then you treat it. So these are some of the causes of pleural effusion. Thank you.
Thank you so much, brother, for giving us this in-depth understanding of the causes of pleural effusion. Now that we know the causes, could we please go to the signs and symptoms so that we will be able to recognize, to identify if we are experiencing something, or something is, happening to us that we don't know, how could this be? Then at least if we know of it, we'll be able to say, oh, that could be this, without us giving a proper diagnosis, but we will follow up from our doctor's point of view. Thank you so much, brother.
Okay, thank you. For every cause, there is effect. When things are going in orderly way, you see your symptoms being okay. But when things goes in a disorder within your system, then you begin to also experience some funny experiences or some funny things that ideally you need not to also receive. So what are some of the signs? You get chest pains, but take note, we want to our viewers and our listeners to get us clear. It doesn't mean that when you are suffering from chest pains means you have pleural effusion, but we are saying that aside what we are building up to this level, these are some of the things that can also be present when you have pleural effusion. Therefore, when we know the signs, it will help you and I to be able to detect when there is error fast, so that when we prove further, we can say, oh, it's pleural effusion or it's different lung condition. So let's put that in mind. Number one is chest pains. So you see, the chest area, most conditions can lead to chest pain. But with this one, the chest pains is what we describe as pleuritic chest pains. The chest pain, very severe, very, very severe. At times, looks sharp, like someone piercing your chest. That's the pains. As you see the man, he's a man, but you see when the pains occurred, how the face has turned, it means the person is passing through a lot. Yes. Another one is difficulty and painful breathing. Difficulty breathing. The person is breathing, but because there's a problem within the lungs, it's like some of us who knows how to swim. When mistakenly you encounter someone who also don't know how to swim, then he's drowning. You see how the experience that individual goes through. That explains the difficulty in breathing. Your lungs, in a way, is like drowning. So as it's drowning, the difficulty, you need excess force to help you breathe. And that difficulty or that sharp experiences or uncomfortable experience that will come when breathing is what we term as difficulty in breathing. Painful breathing. When the individual is inhaling, He feels the pain sharp. So painful breathing. Breathing in, you see, very sharp pain because it's going to add up to the already existing. But the lungs to work on it is also in trouble. So difficulty and painful breathing aside chest pain is another aspect. Then we have what we call cough. But in this case, we have non-productive cough. You see, we have, when you take cough, we have productive, where the person will cough and bring out phlegms. Then unproductive, the person is coughing, but nothing. It's like a dry cough. So we have most people also experience cough. So with pleural effusion, the cardinal sign that might always come in places: chest pains, pleuritic chest pains, the difficulty in breathing, then non-productive cough. When that occurs, anytime you visit a place or your care provider, then you mention these signs, per him also assessing you. When there is signs like the asthma too, you experience these things, but upon further investigation, you realize that he will be able to detect which one is are you suffering from, then we treat it as such. So aside, for some individuals too, when they lie flat, that's what we call the autopnea. Their difficulty in breathing is when they lie flat. Unlike that, you see, we have a heart failure. The heart is being flooded. So when the person lies flat, it's like you pouring the fluid in the lungs to accumulate there. Then the person experiences difficulty in breathing unless you either raise the head side of the bed, then you realize the person is comfortable. Or in the house, when you put a lot of pillows at the head side, then you see the person is relieved. But when you take the pillows off, you realize that individual is going through serious of difficulty in breathing. Then also night sweat. Remember, we have mentioned that tuberculosis is also a cause of this. And one of the signs of tuberculosis, aside the cough, the chest pain, night sweat is also present. And some individuals with this also have sweat. It's also another thing. Then sudden weight loss. You see, the person is fat, or the person, because of the difficulty in breathing, mind you, is the blood that needs to have quality oxygen than nutrients. But if the lungs is being affected, your entire system will be affected, because the lungs is supposed to work and play a major role with our blood. So when it happens like that, you are feeling pains, not forgetting, you will not be thinking about eating, and that alone will also lead to sudden weight loss. So you see some individuals, we've seen some people, they started with difficulty in breathing. Upon little work, they are feeling tiredness because less oxygen in the blood. Then sudden weight loss. If you are not careful, they will diagnose you, the family people will diagnose you of another viral condition. So these are some of the symptoms that are likely to be present, and mostly following the lung aspect. So these are some of the things I will talk about in regards to the signs and symptoms. Thank you.
Thank you so much, brother, for giving us the signs and symptoms of pleural effusion. Now we will be able to see. I was very happy when you said people shouldn't take it um, uh, like they've got pleural effusion whenever they get chest pain. Otherwise, everyone will go like, "Oh, I'm having pleural effusion." Any little chest pain that they have, but that might not be attributed to our discussion today. Now that we know the causes of pleural effusion, sorry, the signs and symptoms of pleural effusion, what are the diagnostic investigations of pleural
Okay.
effusion, please?
So it's good that whenever you identify a discomfort, you visit the technical people so that they can assess you well and put you at the right side. Let me create this caution. We have some individuals out there, when their children begins to have cough, chest pains, difficulty in breathing, they just go to any nearby pharmacy, any nearby place. Then when they are going, they are even going with their own prescription in mind. I want to buy a amoxiclav, flagyl, cough syrup. Then they send it home. But you identifying this, you might not be able to ascertain the exact condition your child is passing through. I would advise that whenever you experience some of these, visit a nearby health center for them to really take a full history for you. Because when it's early detected, you get early recovery than you staying and doing over the counter medications. Then it will be the major condition, then now that you begin to suffer the complications. So when you experience the signs and symptoms we've talked about, there are some investigations that will also be added up to confirm what exactly is the condition. Number one is CT scan. We can do the chest CT scan so that the scan will help us to know. We have talked about clots blocking the blood vessels that supplies blood to the lungs. So the scan will be able to visualize the internal veins and other things well, so that we will be able to know your type of cough, your type of chest pain. Is it attributed to pleural effusion or other lung condition? And what might be the exact cause of that? And the scan can give us a clear picture. Number two is chest x-ray. Chest x-ray will help us to know the shape of the lungs, for us to be able to detect when there's an abnormality, because tuberculosis, lung condition, and others can also mimic pleural effusion. So when it happens like that, the chest x-ray can also guide the prescriber to also note where exactly, if it's pleural effusion, the fluid is accumulating, so that it will help the person to be able to perform its procedures well. Another aspect is what we call the sputum test, or sputum for gene expert. That is where your complaints can also be like it's a TB, tuberculosis. So your prescriber will ask you to send your phlegms or your sputum to the lab center, so that they will take it microscopically to detect whether the phlegms that they have attained contains the tuberculous bacteria or what else. Then it will give a picture. Another aspect is the blood test. We will need to do blood test to also confirm any infection, because we've talked about other underlying condition like the liver condition, like the kidney condition that can also contribute to pleural effusion. So we can do blood tests where we check the liver function, we check the kidney function, we check your blood itself, cholesterol level within your blood. Then we will be able to ascertain that no, the exact causes you are going through is not pleural effusion, but likely heart failure or hypertension. Then we will deal with it. Or kidney issue, because with kidney issue too, there will be accumulation of fluid within, because kidney will not be able to bring fluid out. Then we also know. Then physical assessment. When you sit by your provider, as he's asking you questions, and he's also assessing you with that earphone-like thing that they do in the hospitals, that's using the stethoscope, that's the name. You'll be able to hear listen to the sound of the lungs. And also we have another assessment that we can do to know the sound. That's what we call the percussion, the sound that comes from the lungs. Then we know that no, this lung issue you are talking about, this signs you are talking about, per the assessment also suggesting pleural effusion or other lung conditions. So aside the signs and symptoms, this also helps to confirm. Then we can also help or assist you as such. Thank you.
Thank you so much, Brother George. Now, I don't know even if we have some classification. If there is,
Yeah.
what are the classifications of pleural effusion, please?
Yes, we have two classifications. So at times you do a scan or you do some investigation, then they will say that although you have pleural effusion, but your own is exudative effusion or transudative effusion. So what is the exudative and what is the transudative? With the transudative effusion, it means that this fluid is similar to the normal fluid. Remember, we said that with the pleural space, it contains a lubricant, and that is the pleural fluid. That's the normal fluid there. But this transudative effusion, the nature is similar to that fluid. But that case, it also forms from, or you get this condition from a leaking of liquid across the normal pleural. And mostly those, it occurs with those with heart failure. heart failure, where the heart, as we have explained, so there will be a leak of fluid into the space, but it mimics the nature of the normal fluid. Another condition is nephrotic syndrome, that is kidney related condition, that also let fluid accumulate. Then when the fluid is leaking into the space, that aspect we call it as the transudative effusion. Another aspect is the liver issue. So liver, kidney, the heart conditions, their fluid will help it leak into the space, and that will looks like the normal fluid, and that's what we would see with a scan report, that transudative effusion. Then with the exudative effusion, exudative means that fluid from, not from that, so we say extra fluid, either protein or blood, or from the inflammatory cells, or damage to the blood vessels. When that occurs, then fluid is built up in the space, and in that case, the major cause of this exudative one can be pneumonia, can be pulmonary embolism. At times, the problem with the pancreas, you see, it goes above or outside the respiratory system, the pancreas. And the pancreas is supposed to release insulin to help you with that regulation. But the pancreas, when it's also inflamed, can also contribute to pleural effusion. Then also esophageal rupture. The esophagus is the windpipe where food passes. When it ruptures, it can also affect you. Then when that fluid also build up in the pleural space, it will form under the exudative pleural effusion. So whenever you are reading the scan result and you see transudative or exudative, it gives you a clear classification that transudative is the fluid just within, and it forms, it's similar to the normal fluid, but it's mostly from the lungs or the heart or the kidney. But with the exudative, is outside these areas, so either from the blood or other cells, and that can also contribute to this classification. Thank you.
Thank you so much, brother, for giving us this in-depth explanation of the classification of the pleural effusion. As we continue on the program, we encourage our friends and family watching us this afternoon or listening to us to invite friends and family to join us this afternoon. Don't forget to share and subscribe to the channel. Click on the notification button so that whenever there is a program at Richmond Media, you will be notified. Sister Doris Odro Rabbi says, really interesting. Thank you so much, sister, for joining us this afternoon. It's really interesting indeed. It's a great topic. At this moment, if you are watching us and you are very close to the Kumasi area or anywhere in Ghana, or you are preparing to go to Ghana, I encourage you to get yourself ready to go to the Prempeh Assembly Hall on the 23rd of March, where Easter musical concert is taking place. And it is being hosted by Richmond Media. You don't like this. What else would you like? In this festive season, around the Easter time, we are giving you all our heart out. The voices that God has given to us. Come and enjoy part of it. And when we talk of choral, when we talk of music, the background of music, especially when it's coming from the Adventist background, I bet you will enjoy it very well. So make your way to the Prempeh Assembly Hall at 4 p.m. on the 23rd of March. Some of the choirs that are presented are the Adum Choir, the Choir Ghana Divine Choral, KSTU NAS Choir, and then KNUST NAS Choir, and many more that their name is not yet on the flyer. But my dear, you will enjoy that day, and you enjoy the music that the Lord is giving to you that will give you transformation You will have a transformational change that will put you into the industrialization plan. So therefore, Richmond Media is inviting you. Thank you so much for making it a point on that day. Brother George, as we continue, what are the implications of the plural effusion, please?
Okay, complications means that when you see these signs already, one, yeah, let's say you are the individual, you realize that you have a heart condition or underlying condition, but you overlooked. Then its sign is that the lung is affecting, so it's giving you the lungs related signs you overlooked. What can be the third complication? One, there can be the collapse of the respiratory organ, so you can get respiratory failure. Respiratory failure. The lungs has been flooded, trying to compensate, but still we are still doing the thing that is causing. So being flooded, you realize it will fail. Failing means it will not be able to work as it's supposed to be. So it's one complication. Another complication is the collapse of the lungs. That is what we call the atelectasis, the collapse of the lungs. You see, when the lungs is passing through struggles and is failing, and you are not helping, it's failing, then it will give up and collapse. So we have individuals whom, after all these things that we are talking about, you realize that they will do another scan and they will say atelectasis, or the collapse of either the left part of the lung or the right part of the lungs, and that is conditions or complications of this condition. So we want to encourage our viewers and listeners not to reach this stage, not to reach this stage. So we need to prevent ourselves from getting here. Thank you.
Thank you so much, brother. Finally, the preventive measures of pleural effusion so that we will know how to protect ourselves, how to prevent ourselves from getting this complication. Even if we have, we can still put in place good measures that will sustain us to have a total healing of it. Thank you.
Welcome. The preventive measures. We need to note that what is the problem? The problem is that blood, the lungs, then the underlying cause. So anything that we do to affect how we breathe, the air we breathe, can predispose you to a lung condition. And one lung condition that we are talking about is what we call the pleural effusion as its symptoms. So smoking, individuals who smoke, individuals who are primary smokers, secondary smokers, or any form that we inhale smoke, we need to be mindful. Currently, the active class or the youth are most people suffering from this condition. Why? Because most of we, the youth, think that our parents own is a cake and we are involved in smoking. But I bet you, we want to advise ourselves that as a Richmo Media health issues viewer or listener, let's try our possible best to resist from smoke. That is one preventive measure. Number two, every bite you take as food will either fight a disease or feed a disease. And when we were mentioning of kidney problems, heart failure, lung issues, the infections, most of the causes that we mentioned, higher percentage is due to what we eat, what we drink. Because what we eat can predispose you to get excess fat, leading to blockage of the blood vessels. So whatever you are eating can cause a clot, blocking a blood vessels. And if you are not careful and it block the way to the lungs, then you can get what we call the pulmonary embolism. Then you are likely to suffer from this condition. So whatever we are eating, another aspect, whatever we are eating can contribute to autoimmune diseases like the animal dairies, animal milks, and the likes. It can also trigger autoimmune diseases. And we have mentioned that one of the causes of this condition is autoimmune diseases. Therefore, you advise that whatever we are eating should purposely mostly comes from the raw source than the processed source. Should limit oily foods, should limit oily foods, should limit fat related foods, should limit too frying of foods, so that we will not be getting, or we will not be predisposing ourselves to this condition that we are talking about. So it's also another aspect that we need to talk about. Another aspect is lifestyle. God creating the light for us is very important, because out of the light we will get vitamin D. Out of the sunlight we will get the heat from it that will be able to help create a heat environment, promote blood circulation, prevent clots and others. So we need to be exposing ourselves to certain lifestyle adaptation. Most of us are indoors, air conditioned room, air conditioned car, air conditioned office, air conditioned restaurant, or air conditioned dining hall. So always our lifestyle is air conditioned, air conditioned, air conditioned. But let's have some space of our air conditioned schedule tight time, so that we can expose ourselves to the sun, and by so doing we will get the benefit of it, preventing us from the lifestyle condition, autoimmune diseases, and this condition we are talking about. And how can we get it? By just coming into contact with the sun is one. Number two, what we call the sun bath. Sun bath. That's where you sit in your chair, or you bring that individual to your chair, then you just expose to the sun. Then you fold a towel as a preventive way to prevent the eye from its condition on the eye surface, as you are seeing on the picture. Then you can stay within. For a lighter skin people, 15 to 30 minutes is okay. Then you sweat, you go inside, you shower, then that's all. Then for the dark, like us, you can be in it for 45 to an hours. Then as you sweat, it creates that heat environment, and it promotes circulation, preventing you from the heart condition, relieving the pressure, then you also getting a better lungs. So it's something that we need to be particular about these things, because these ones you not buy, rather than you getting that condition, inhaling of fresh air, because the condition affects the quality of your air. And how can we get enough quality air within? One is about deep breathing exercise. Deep breathing exercise. That's where you do the breathe in and breathe out. You close your mouth, then you deeply but slowly inhale the air through your nose. Then you wait for like 5 seconds, then you exhale through your mouth slowly. When you do that morning, evening, it helps the lungs. It's the exercise of the lungs. And when that occurs, the space is in action, the muscles is in action, and there will not be dysfunctioning of the lungs. So deep breathing is one. Two is singing. Singing. So don't wait to be named or to get a talented voice before you sing. No, when you wake up, while you are walking, while you are doing something, begins to be singing. And that also exercise the lungs. So as we are inviting you on 23rd, you realize that when the divine chorale is singing and you don't have the voice, but at least you have overview of that song, you also singing. In addition to them, you are singing, raising your hand, and that is also a form of exercising, and it's one way to prevent you from lung conditions. So singing is another aspect of the how we can get adequate air into the system. Another aspect is blowing of balloon. Blowing of balloon. So you see, the trumpeters will blow their trumpet, then the ballooners will blow our balloon. So whenever you realize that it's not Christmas but there is balloon around, please, let's get balloons and be also blowing. It also help exercise the lungs, also help the lung to be well efficient, and by so doing you prevent so many conditions, including this condition that we are talking about. Then we have what we call the steam inhalation. You see, when there's dryness in the lungs, the space or the alveoli is not able to, that's the sieve within, the dryness and filth will block this space, and you will not be able to get quality air, and it will affect the function. But when you are doing steam inhalation, where you boil water, then the vapor is what you are inhaling, like you are doing the deep breathing exercise. but this one you are inhaling the vapor. It moisturizes the lungs, especially the alveoli, so that it can be able to take out any filth that can predispose you to infection. Mind you, when there is dirt within the lung space, can create an infection medium. So you need to bring it out as a form of cough. And when you do steam inhalation, it also helps clear these filth from the lungs. It's also important that we need to also inculcate. Another aspect is exercise. But note, we those talking and those listening who don't have the condition, we can do the brisk walking, we can do all the forms of exercise. One. Two, we those suffering from the condition, you cannot run. You cannot do that excessive exercise compared to someone who don't have. So you those who is having, your exercise when it comes to this angle is breathing exercise, is the balloon blowing or inflation of you get a glove, you do improvised balloon, then you use a straw, then you get a glove, you put in it, then you tie with a sellotape or a plaster, then you also be blowing. It's also your exercise. So if you have the condition already, the exercise you will do will be different from someone who is not having the condition. Therefore, if you want to embark on any form of exercise amidst this era, consult your prescriber so that he can guide you. You can walk, or you can jump, or you can do this to prevent other complications. Now, we have mucus producing foods that we need to be mindful and reduce or eliminate from our diet, like the egg, like the fatty foods, because we are talking about cholesterol. So we need to refrain from this meat, flesh meat, because the Bible even says that Leviticus 3:17 says, it shall be a perpetual statute that throughout all your generation do not eat fat nor blood. Therefore, if you want to get a healthy blood vessels, be mindful of flesh, because when it comes to cancer, research also have proven that cancer is largely due to the intake of flesh or red meat. And you know, red meat or cancer of the lungs can also lead to pleural effusion. So we need to be mindful of what we take. Then animal milk, because we've talked about autoimmune disease, and animal milk contains a protein called the casein. When it gets into the system, the body sees it as it looks like the normal protein within the body, but over time you realize it's, oh, you are a foreigner. Then it will trigger autoimmune response. So be careful with animal milk. So you see, let me chip in this. You see, breastfeeding mothers or pregnant women who have actively been taking animal milk, they are always likely to give birth to a child with lung issue. Then those who are also feeding their children not with breast milk, but with the animal dairy and the processed things, their children are also likely to suffer from lung condition like asthma, and they'll be diagnosing them like bronchitis and co. So we need to be very careful about these things. Rather, you can do your own milks, like the almond, you use your almond and you do your milk. Coconut, you grate your coconut, blend, strain, that becomes your milk. Tiger nut, you soak your tiger nut because it's hard overnight. The next morning you blend, you get your milk. So if you want to give milk, then let's look at the best, but not the worst. Because cow's milk are for the cow, whilst animals' milk are human beings are milk are for the babies. So we need to be mindful of that. Then another aspect is sugar. Refined sugar is what we call the sweet poison. We can get more than 1,000 conditions that emanate from sugar. So we need to be very careful, because sugar itself affects the elasticity of your lungs, your blood vessels. And when this occurs, it also is a mucus producing food. So we need to be mindful of the intake of refined sugar. We need to be very careful. Then two frying foods, oily food. So you see, individuals suffering from this condition, when they want to be guided dietetically or in a naturopathic way, we mostly take them off from oily foods and sugar and those things. Then we guide them well, and we have seen great results out there. So we want to bring it in. Then you do the lung syrups, lung things that help the lungs. Water intake, you taking water alone is something that can help the lung. You taking water alone. Bathing, because infection can cause lung problems. So bathing is also a remedy or a therapy that can also reduce infection. Then onion. Onion is mucus melting food. Therefore, we encourage and advise once again that because it's good and we are using them, don't take it when you are going to sleep. Don't take it when you are going to sleep, because the mucus that has built within the lung space will melt. But because you are asleep, you are not able to spit these phlegms out. So it's best you take it morning or afternoon within the day to help the lungs. Same like its friend garlic, also helping the lungs. So beloved, then the last one we will talk about is the ginger and the honey syrup or tea. So when we do all these things, then we make sure we are following all the laws of health and lifestyle changes, this pleural effusion can be prevented. That's the primary prevention. We those who have not get it. But we those who have acquired it and have been detected at the early stage, it will be the secondary prevention. We can reverse it. Then we those who have had it and have gone through chest tube passing and is facing some complication, the tertiary prevention or from it affecting other organs, when we do this, we can reduce the major complication to the point that we'll get to the collapse of the lungs. And above all, have a positive mind. That is a condition that can be reversed, but it's not a condition that you have been diagnosed means you are going to die. And that positive mind will yield a positive result. That's what we stand in for as Richmond Media Health Issues. Thank you.
Thank you. Thank you so much, brother. A positive mind will yield a positive result indeed. Sister Beatrice Jamfua says, God bless you, doctor, for such an educative program. Thank you so much to our viewers and our listeners who have made it possible to join us this afternoon. I'm very sure that indeed, even if you didn't hear anything, you heard that a positive mind yields a positive result. To my brother, Mr. George Ackon, Richmond Media cannot stop thanking you for your time, your devotion, your hearts, the love that you have for Richmond Media. May it continue to grow deeper and deeper and deeper until the next generation. God bless you. I don't know which words to choose at this moment, but only God can direct our path. And to Sister Josephine, thank you so much for always giving your half to us. Though you want to be full, but thank you for giving the half to us all the time. God richly bless you. To everyone who made it possible to attend this afternoon's discussion at Richmond Media about pleural effusion, it has been really good to be here. Our sister Tai says, really mind-blowing. Thank you for sharing your knowledge with us. Thank you, Sister Tai, for your love, your support for us all the time. May God continue to bless you as you continue to enhance your territory. To everyone, we say, may God richly bless you. The same time again next week, health issues at Richmond Media. Until then, my name is Hanna Bimah, and it is bye-bye for now. God bless us all. Thank you.
Where 우리 지치 비는 수리 애자의